Hello, I'm Dr. J.C. Smith at Smith Spinal Care in Warner Robins. Today I want to talk to you about my resume. I've been in chiropractic as a patient and as a practitioner, as a doctor of chiropractic now for almost 50 years. I first hurt my back playing football at the University of California, Berkeley, the Golden Bears. And I was catching a ball and a 230-pound defensive end nailed me, blindsided me. I was looking for the ball and he nailed me. I never saw him coming. Drove me into the ground. When I woke up 20 minutes later, I couldn't move my left arm and my mid-back was crushed. So the team doctor gave me pain pills and muscle relaxers, which just got me high and constipated. But my roommate, who was an Olympic long jumper, said, "You need to see my chiropractor in Oakland," who was taking care of the Oakland Raiders at the time. He was as big as that door, and a big man himself. So they literally carried me in. I was in that much pain. And Dr. Frank Young adjusted me in my mid-back. I heard a little popping noise, and that's all he did. I thought to myself, well, that's not very much. I was expecting some big theatrics, right? Well, guess what? A week later, I was back practicing on the football field, and the same little doctor who gave me the pain pills and muscle relaxers, little because he was a short man, he was the orthopedic surgeon, he came up to me and said, "Well, Jim, I guess those drugs worked." I said, "No, I just got constipated and high." And I said, "No, I went to a chiropractor." He goes, "What? Well, that doesn't work." And I said, "Well, how can you say that? I'm back here, aren't I?" I didn't know about the medical war at the time and the bias that they had. But anyway, he kind of backed off when he could see that I actually was better. And he goes, "Well, it may work for some things, but when they say they can cure diabetes, they've gone too far." You know, in my whole career, I've never heard a chiropractor say that chiropractic will cure diabetes. But this is a lie the medical world tells themselves to invalidate us. Anyway, after that experience at Berkeley, I announced to my parents I was going to go to chiropractic college. Well, just to show you how strong the chirophobia was at the time, my mother started crying, and my dad says, "Why do you want to be a quack?" That was back in the 60s when the medical war was at its height of disinformation. Turned out her father, my mother's father, he died of colon cancer. I remember I was at Cal as a junior when that happened, and anyway, they blamed him for it because the first doctor misdiagnosed him, gave him pills. He went to an orthopedic who misdiagnosed him. What he had was referred pain from his colon cancer back to his spine. So he went to the local chiropractor who properly diagnosed it. He said, "You got something else going on." He sent him to the hospital. They diagnosed stage 4 cancer. 2 weeks later, he was dead. But because he was the last doctor that my grandfather saw, he was the scapegoat. And when they told me that story, I said, "Well, why are you mad at him? Why aren't you mad at the MDs who misdiagnosed him and mistreated him?" So anyway, that was the starting point where I suddenly was rudely awakened to the fact that people have some bad attitudes about the benefits chiropractic offers. So since I've been practicing here, I do a lot of writing. You may have heard me talk about my first book, The Medical War Against Chiropractors. And then I followed this part 2, was the media war. I entitled this To Kill a Chiropractor After To Kill a Mockingbird. And this talks about how the media is very much involved with misinforming people. For example, when was the last time you've seen on the news an in-depth, fair and balanced article about the benefits chiropractic brings an ailing world that suffers with opioid addiction and failed back surgery? And we're the best solution, non-drug, non-surgical. And we're the 3rd largest health profession in the world. You never hear about it. Have you been told that there's been 4 studies done recently that chiropractic care reduces opioid consumption by 59%? I dare say if there was any medical, pharmaceutical equivalent, it'd be all over the news. But when chiropractors achieve that, non-drug, non-surgically, it doesn't get out to the public. Again, the media really controls what you're hearing about chiropractic. Unless it's a bad event, then you hear everything about it. But nonetheless, I've been here now for 40 years. I have the best equipment, the best staff, the best programs for the worst problems. So if you're suffering, even if you've been to other chiropractors, other doctors, physical therapy, even if you've had surgery, you may be helped. We help many people with failed back surgery, and if not 100%, because you're always going to have the damage from the surgery, the scar tissue and all that stuff, but we can help you to a degree. I like to tell people with failed back surgery, let's get you 50% better, because that's an achievable goal. But it requires you learning how to take care of your spine with exercises, proper posture, even sitting and sleeping properly. So we're going to teach you all that. But if you're serious about getting well, I want you to think seriously about coming to my office, because we're a notch above the rest, I believe. Otherwise, hope to see you soon. You're welcome.